Welcome to another Ask the Doctors on Whitewater Community Television's WGTV Channel 11. After a couple of weeks off, I'm Eric Marsh, somewhat back. This is a pre-recorded version of Ask the Doctors, so we are going to talk about some questions that we had come in previously and catch you up on some things that are going on. We are actually recording this on Monday the 10th, so if you're seeing this on Friday, there may be some things where you go, oh, that changed. That's the reason why. Just timing of all of our schedules for this week. We hope to be back live next week. Our guests, as they always are doctors, Dr. Thomas Huth from Reed Health, Dr. David Jetmore, Wayne County Health Department, and Christine Stinson has stayed with us just because she likes the show and she wants to hang out with us.
Cool kids.
Executive Director, Wayne County Health Department. Thank you all for taking the time and doing this. Dr. Jetmore, we will start with you. I know it hasn't been a week since you kind of last updated us, but if you can tell us, things seem to be changing so rapidly, it only takes a couple of things. What would you like the community to know at this point?
Well, I think it's important for all of us to realize that the virus is still out there, and it has, we're in the middle of this basically second wave. Somebody might argue it's an extension of the first wave, but infections are on the increase. Luckily, the death rate and hospitalization rate and use of ventilator rate has not gone up in proportion to the increased infection rate. It's important that all of us continue to mask and socially distance. I know you're sick of hearing that. I'm sick of saying it. And of course, good hand hygiene. School is starting. I'll probably let my colleague Christine Stinson talk more about that. But that's the state of the county, Eric. That's where we're at, pretty much unchanged from where we were on Ask the Doctors last Friday.
Dr. Huth?
Well, I think since we last spoke, the news is all about the start of the schools and sports, and before we went live, we mentioned that some of the college basketball or sports leagues are announcing closures and so forth, and they're expecting more. And I guess we're going to see more of that kind of thing. We can talk about some of the implications of that. Mm-hmm. I know that the increase in cases around the world is getting close to 20 million cases. Nothing special about that number except that it's a nice round number, and it's a lot of people worldwide. The U.S. numbers have moderated somewhat, but there still are quite a few, in excess of 55,000 new cases a day in the U.S. So that is concerning. And I'm a little bit concerned about the appearance of the Indiana numbers because they have continued to increase. We thought they were going to plateau off, but in the last week it's continued to increase, and that distinguishes Indiana from some of the surrounding states where the numbers had been up, but they're tailing off now. And then, of course, here locally, we've had more cases over the last few weeks, but moderating a little bit, especially in Reed. But that doesn't mean we should let up our guard at all.
Christine, you're the smiling face here that everybody adores today. Tell us how your weekend went, and as we head into this week, what you're seeing.
Yeah, pretty much what Dr. Huth and Dr. Jetmore both have said. We're kind of just at this new high. I didn't see anything trail off. I did see a couple of cases in some long-term care facilities. I'm always concerned when I see any case there, although our long-term care facilities run very tight ships. So when they do get a case in there, they lock everything down, and that is isolated very quickly. And a lot of testing is done amongst the staff and all the other residents. So we hope that those are just minor isolated cases that happen at the long-term care facilities. And probably the big thing is schools. today, probably 90% of my day was strictly on schools. And the other 10% was explaining to someone else about what's going on with the schools. So schools are eating up a lot of the time. And my weekend was ate up. I talk with superintendents and nurses and everyone all weekend long, trying to help them navigate through what we do when we have cases. So as you know, last week we had a few cases in some of the schools, and it continued through the weekend where students were resulting over the weekend that were positive, and the school is, what do we do? And it's always very simple. We look at our plan. What does our plan say to do? And that's first to go through and identify who those close contacts of this student was. So anyone that's been within 6 feet of this student for longer than 15 minutes. So when you start thinking about it that way, it does reduce down the numbers that are in that bubble. And I think as we go along, the first couple of cases in the schools are going to be bumpy. Everyone's going to feel like, this doesn't feel normal. How do you do this? And we'll trip over each other and things like that. And then it'll get smoother. And I think that everyone will start to realize why we want that separation. A, it helps to stop disease spread. And B, it helps to reduce how many kids have to go out of school for that 14-day quarantine when there is a positive case. So we had one case, one student at one school that put 30 kids out for 14 days. That's a lot.
That's a lot.
But when you think about it,
is that because there was a classroom of people that wasn't socially distant or extracurricular activities? I'm not sure how much you can tell because of privacy, but one student around them.
Okay, elementary school kids are a little different. They're stuck right there. They're in their cohort. They're a group, and they kind of stay all together that day. And even when we go to recess, we can cohort those children together and keep them. And it's easy to keep a cohort kind of identified who was and who wasn't. When they get into middle school and high school, those kids then are intermingling. And first period, you're with this group of kids. And second period, you're with this group. And third period, and then lunch, and then the bus, and then other activities. Mm-hmm. So when you look at someone like that, that's interacting in a lot of different, when you have 3 or 4 in this class and 4 and 5 on the bus, and 3 in this one and then 5 in this one, 30 becomes really easy to get to. Really easy to get to. So it shows why it's so important that we do that 6-foot separation. Mostly we want it. Me and Dr. Jetmore and Dr. Huth want it because we know that it slows down the rate of transmission where we all stay apart. But everyone else should want it, even if you don't think that it's going to work to slow down the day. Just think about, the more we do this, the longer the kids stay in school. So maintaining that 6-foot bubble around everyone keeps those kids in school longer. For us, it keeps cases down.
Let's talk about, if we can, the case that was 2 cases, I guess. And again, I know that there are certain things you can't say that were Centerville related. There was some, and we'll call it controversy. That's what it was. Because as I understand it, and I don't have all of the information, students took a test came back negative, but from the health department standpoint, you all said that they should be considered. So on the day we're actually recording this, Centerville schools are closed. The school is closed so that some mitigation and things can be taken care of. Talk about why you felt that even though the test was negative, you all still needed to kind of step in and say that needs to be assumed to be positive, because that really kind of set some people off on edge. Okay.
Dr. Jetmore, I'll take the first part of it, and then I'd like for you to jump in about a little bit more of the clinical diagnosis. But there has always been two ways people are identified as COVID positive cases. There are clinical cases and there are laboratory cases. When you look at the Indiana State Health Department's dashboard that we all take a look at and we say, oh, Wayne County has 300 and X amount of cases right now. Those are looking at the laboratory confirmed cases only. But we always have gotten lab cases and clinical cases. So a doctor will look at that case symptomatically and say, this person, regardless of what a test says, has COVID-19. All of the symptoms, all of their chest X-ray, their CT scan of their chest, it all says COVID, even though that test is saying otherwise. So this isn't anything new. It's just the first time that we've isolated kids out of school because of it.
Okay.
Let me just address, the clinical diagnosis of COVID from a physician's standpoint. Now, there's the symptoms of COVID are a cough, shortness of breath, headache, fever. Some people may have diarrhea. These symptoms, if you talk about a symptom like a cough, that could be anywhere from, that could be a cold or TB. I mean, it's a very generalized symptom that occurs in a lot of different diseases. The one thing that made clinicians feel like these two children had COVID is their loss of taste, and which is usually associated with their loss of their sense of smell. As an ear, nose, and throat doctor, I've never seen loss of smell in a child. I've never had a child brought in because they'd lost their smell and secondarily their sense of taste. So that's a very unusual symptom. In fact, as adults, I might see only 2 or 3 cases a year in adults. So when we hear these children have the symptoms of COVID coupled with the fact that they've lost their sense of taste and smell, to me, that child has COVID-19, no matter what the testing says. Now, that brings us up to the point, up to what testing is. These tests are not infallible. They're not, sometimes there's a certain percentage in the nasal swab test of false positives. That's very small, but there's a much bigger rate of false negative. So it was my opinion that these children had COVID and false negative tests.
Okay. There was a feeling for a period of time that because we weren't seeing a lot of kids diagnosed with COVID, that kids were, I don't want to say immune, but less likely to get it. Does getting them out of school and away from each other for that extended period of time, could that have had something to do in any of your minds with why we weren't seeing as many kids diagnosed?
That may be a factor, Eric, but another factor might be the fact that children, and Tom might have a percentage answer to this, but I've read that children are more often asymptomatic than adults, and their symptoms may be very slight. They may have a headache for a day, and that may be the only symptom that they exhibit from COVID. You have any further thoughts on that, Dr. Huth?
Oh, all of that is true. In addition to that, some people think that the virus may have mutated so that it's more infectious to younger age groups. I think this, we don't know for sure, but that could be a factor too. But I think, it certainly is true that in the spring when it became a thing, the schools all closed down, and now we're trying to kind of reverse that process. So I think we are going to see more cases associated with schools and with children. But I think it's also a good question is what should be the appropriate response to that? We're going to see those cases, but we do know that it's very clear that children are much less likely to suffer from the severe complications from COVID-19. And there's some discussion about how transmissible they are to adults. Several studies have shown that in clusters where there were children involved, they felt like the vector was more from the adults to the child, that children tend to get infected more from their family circumstance than from other group circumstances, as an example. How that's going to change with a lot of kids going back to in-person classes, I don't know. But the vector tends to be from adults to children in the previous research. But it's not nothing. I mean, we don't want to take an all or nothing attitude. We don't want to say children are the major vector of transmission. That's probably not the case. Neither do we want to say that children are no issue at all. We don't want to say that they are immune. That term has been used, but that's probably not very appropriate. They're not immune, they can get it, and we know that that's the case. We also don't want to say that they're never a factor in transmission, because they probably are. So there's some place in the middle is the right place to be. But I think the question as a society and for the school system is, what's the appropriate response to that? And I wanted to make a prediction just based on previous experience. When we first started seeing it in hospitals, it was new. Everybody was uncertain what to do. It was a big deal. When we had our very first case in the county, we had press conferences and stuff like that. Now we're way beyond that, and we feel in the hospital, we now feel very confident in how to protect staff, how to protect each other, how to protect other patients who don't have COVID, and how to manage the COVID patients in the hospital. I think Christine mentioned long-term care facilities. Back in the beginning, when long-term care facilities got in a case here or there, it was a big deal, and everybody was excited and uncertain what to do and a little panicky. But now we're seeing some cases where, we can handle this. They're not that sick. We know how to isolate people within the long-term care buildings, and we know how to deal with it. And so I think what we are finding now is that when we identify cases among staff, which I know that there have been a pretty good number of those recently, and a few residents of long-term care facilities, nobody's panicking. We have an approach. We know what to do to keep everybody safe. I think there's going to be a similar pattern with the schools. Right now, it's all new. We've never been there. We don't know. We're uncertain. The administrators and the teachers haven't dealt with directly very much with COVID people in their own lives, or most of them have never done. And so once we kind of get a pattern, a successful strategy going, I think they're going to get comfortable with it over time. And and in the future, I think we'll see less of closing down entire schools, but a more targeted approach within them once they get comfortable and understand their own environments and how to deal with it. That's my prediction. You guys can, mark it on your calendars on this date. Huth said X, and in a couple of months, we'll look back and decide whether Huth knew what he was talking about or not. But I think it's just a good bet based on previous experience with other situations. And we could multiply that with EMSs and other folks who've had experience with COVID and their staff and in their situations. But I think that's where we'll be. But I'm not sitting here telling anybody I know what they should do right now. I think we're all kind of learning as we go.
And I think you're right, and that's why I said our first couple of cases are going to be bumpy. And we're going to be sitting, at meetings in January of this year, looking back to what we did in September and said, oh, remember when we freaked out about that? And so this is new territory for all of us. It's new for superintendents, for principals, for school nurses, for the kids, for the teachers, for the health department too. We're navigating our way through a worldwide pandemic. And I think, Dr. Huth, you said one time, and if it wasn't you, I'm going to give you credit, and don't tell me if it
Well, if
wasn't.
it was a good one, I will take credit, but go ahead.
You talked about how, polio, it took us 40 years to get a vaccine for polio. And we're just in the infancy of this disease. And we're just learning, we're months into a new disease. And we've already figured out, how to safely have businesses open. A lot of countries have had schools in session and they're going just fine. And we're working our way through this. We're getting comfortable to these ideas of wearing masks when we're in public and the social physical distancing of each other. And let's all give each other some credit here. We've only been doing it for about 7 months. So I applaud our community. I applaud everyone for sticking with it and listening to the experts in the field and doing what's best for the community. And I don't think our commissioners get enough credit, and our mayor. I've looked around to see what some other communities are doing for their community with this. And I look at what our commissioners and mayors have done. And I think that they are doing everything that they can to make safe workspaces, to provide people with masks. I don't know of another community in the nation that handed out 300,000 masks bought by their commissioners and their mayor. So I would like to give kudos to our executive branch right now.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. We are not streaming on Facebook Live today, as this is a pre-recorded show, but it is available at CTV3 down in Connorsville. There was a question. We're talking about schools, and we spent a lot of time on it so far, but that really is the central core right now. We are in Indiana. We are in somewhat rural Indiana, and schools are still the center of a lot of our communities. So we had a question come in a couple of weeks ago on Facebook that I want you all to kind of tackle. Schools require proof of vaccinations prior to starting. Why not a back-to-school drive-through testing site? Are we okay with an asymptomatic virus entering the schools? Can you all talk about what that kind of effort would take?
Well, first of all, I love the idea of drive-through testing. I think that is a great idea. But drive-through testing at schools, it would take a Herculean effort to do that. And I don't think that there is the ability to do that right now, especially with the kind of testing that's widely available. So do I think that it's a good idea? Yeah. Are we there yet? No, I don't think so. I really don't. That test is a snapshot in time and can change, the next day. So that's kind of my opinion. I'll let Dr. Jetmore and Dr. Huth say their.
Well, I can only echo what you said, Christine. I think it's a good idea. It's just that we do not have unlimited resources as far as testing goes. I don't think you'll ever find anybody in this involved with this pandemic that isn't in favor of more testing. And like Christine said, if you get a negative test, that tells you, that's a snapshot in time. It tells you you don't have COVID, but it tells you nothing about tomorrow or the day after tomorrow. So the more testing, the better. I just don't think we have the resources at this time to make this come to pass.
And I would just add in, I agree completely. It'd be nice to be able to test every kid every day as they're coming into the building, but that's the kind of thing you would have to be able to do there. So the testing technology probably has to change in order for that to be a practical solution. I heard recently, I've been hearing, I heard recently, like maybe last week or the week before, and then probably a month ago, they think they're able to train certain dogs to smell COVID. I think I'm very skeptical about that. I think it might be some kind of a fake thing going on, but
I hope it's a Frenchie.
That would be not. It would have to be something like that. Your kids file in past the sniffer dog who sniffs out COVID on your child. But I just would draw the parallel with the hospital. we don't have big problems with COVID amongst staff. We don't have it from passing from staff to patients or staff to visitors, and that's because. But is there somebody amongst the staff walking around this building I'm in who's positive for COVID-19, who actually has the virus, is carrying it? That's very possible. And I don't like the idea that somebody would be, but we do know that we have learned that we can count on our measures to protect everybody with the distancing, with the masking, with shields in the appropriate circumstance, with people symptom monitoring, taking temperature every day, which is an expectation here. These are the things we do, and we're constantly monitoring the environment for how well that's working. And it appears to be working pretty well. If I had the ability to test everybody every day, I would do that here, but we just don't have that capability. So being able to take it out to all the schools is just not a practical thing at this point. We need better testing capabilities, not just volume, but also the technology has to be different.
Can you talk about what you are hearing as far as better, faster tests? I mean, I think our national administrators, the president and some of his staff are being tested on a daily basis. We've got basketball players in a bubble who are being tested on a regular basis and getting some pretty quick results. We've got Major League Baseball players getting tested on a pretty regular basis to the point where, we've got the Marlins and the Cardinals losing games because their people are testing positive. When does something like that begin to work itself down to us little people so we can have some of the same type of rapid testing and responses that they're getting? Are you hearing anything about that?
I don't know how, the NBA has created this bubble in Orlando, and they're playing all their games in venues there close to one of the Disney resorts where they're all staying. And once they're in the bubble, they can't go out, and everybody inside the bubble gets tested frequently. And it works for them. It seems to be working okay. I don't know what technology they're using, but I'm going to guess that it's the antigen testing and not the nasal PCR, because the nasal PCR can take a little more time to come to result. The antigen testing, which is testing for the antigens of the virus, not the genetic material directly, that can result in 10 to 15 minutes. So they're probably doing a more point-of-care type of test that results super rapidly. I know that's what they're doing when people go to meetings with the president. They're doing the antigen testing on site because the governor of Ohio, DeWine, was supposed to meet with the president at an event in Cleveland.
Right. He tested positive and then he tested negative.
So he tested positive and couldn't go to the meeting, and that night was tested with the actual nasal swab PCR test, and actually repeated that over the weekend. I haven't heard the second result, but the PCR test was negative. And that highlights the issue with the antigen testing. Its pluses that it's super rapid and it can be done, at the point of care, we would call it, with a rapid result, but it has a higher false positive rate than the PCR test does. I'm not sure what the percentage is, but I think it's in the 80% to 85% range for its specificity. And the specificity kind of tells you what the false positive rate is going to be. Whereas for the nasal swab PCR test, the specificity is in the 98 to 99% range. So you only get about 1 or 2% false positives out of that. And, I'm sure that's what happened with the governor of Ohio. It was a false positive based on first having done the antigen test. But the antigen test is something that would potentially be leverageable in a group setting for people coming in on a daily basis, or maybe testing everybody once a week or something. It's what the state of Indiana is trying to deploy to all the long-term care facilities. So they're more easily able to do the rapid test on site for all long-term care facility residents and staff on a regular basis, even though it doesn't perform quite as well as the nasal swab PCR does. It's something that may be more helpful in those situations, and then you would follow those up with a PCR test. Now, I would note that because I've mentioned the antigen test, in Ohio, I should say in Indiana, you're a positive on the state statistics if you have either the standard nasal swab or you have the antigen test. In Ohio, it's not that way. Ohio will not take the antigen test as a positive. You have to go get a confirmatory test by PCR before they'll register you as a positive. That's something that the two states are doing a little differently.
Watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21. If you all don't mind, I'm going to backtrack to a couple of things that were said earlier. Indiana's numbers have continued to climb. I haven't seen the numbers for today, but I think as of yesterday, there were 4 straight days over 1,000 additional cases. But you also mentioned, Dr. Jetmore mentioned, deaths, hospitalization, ventilator rate not going up, you would expect for the number of cases. Can you talk about why you think that is the case? Has the virus mutated a little bit? Is it not as serious? Are we getting more used to it? Are we closing in on herd immunity? What's the positive from that?
Probably the two main possibilities have to do with the mutation theory. We know that the virus has mutated some, and that's to be expected. That's what these things do. The theory is that it's mutated to a more transmissible, but a less virulent form. And so that's one possibility. Another possibility is that deaths have remained low, partly because of the age shift to a lower age demographic who tend to have less severe outcomes. And Christine mentioned a couple of weeks ago, which I think is probably a significant piece of this, is that we're doing a much better job of protecting the most at-risk people, like, for instance, long-term care residents. The long-term care facilities are much more comfortable, know what to do, they're testing everybody regularly, they're reacting much more quickly to control things before anything can get out of hand. The other possibility is that as the cases go up, we shouldn't expect to see a concomitant increase in deaths right away. Deaths are kind of a later manifestation of the phase of the cycle that you're in. The case counts will go up initially. Deaths, if they're going to happen, are going to happen beginning probably in 2-3 weeks, something like that. Now, the argument against that particular explanation is that we've had an increase in Indiana and actually across the country for 6 weeks or more. And yet, over that whole time, deaths have not significantly increased. You can see that in Indiana statistics that the deaths remain low, kind of plateaued at a certain additional deaths per day, despite the fact that the cases are going up. And, I would expect that the deaths should have started to catch up by now, but they really haven't. And so that's a good sign. I think that maybe we're dealing with these other explanations, the age shift, protecting the most at risk better, and there could be mutational things going on that make the virus a little less virulent.
Well, if we go back to the beginning, back to the start of this and the first cases that we saw in the United States in Seattle, lost how many people in long-term care facilities. And then you can even take this to Indiana, where most of our early cases happened in outbreaks that were in long-term care facilities. Mm-hmm. And that's why they developed the strike teams. That's why, all of these guidelines were done for the long-term care facilities. And you just don't hear of those outbreaks in long-term care facilities anymore. In Wayne County, the governor did allow for indoor visitations to start happening in long-term care facilities. But that happened at a time that Wayne County's cases were starting to go up. And Dr. Jetmore, because he's a very smart man, said, maybe we should hold off on indoor visitations. It's still nice out. We allow outdoor visits. We know that visiting outdoors is safer than visiting indoors. We know that visitation for long-term care facilities are important. We want that to happen, but we got to keep this out of the long-term care facilities. So we had to have a directive here in Wayne County where we don't allow indoor visits. We encourage outdoor visits. And we still haven't seen any of those outbreaks in any of our facilities. Have we had cases here and there in facilities? Yes. We've had a case here and there in facilities, but nothing like we saw in the beginning of the cases, where it was scary how many cases. It would just spread through them like wildfire.
I want to mention, you mentioned the cases in long-term care. I'm sure that they're there. We know about them because the long-term care facilities are testing everybody, asymptomatic. Mm-hmm. Everybody in the building, staff, residents are getting tested, so we're discovering them. So, yeah, we have more cases, but we're not waiting for them to get sick. And by then, it's been spread far and wide. That's when we're, the horse is way out of the barn at that point. It's a much more proactive testing and tracking system now that we're discovering them. So I don't want people to get worried about the increase in cases. I think it really has to do with we're actively looking for the people who are positive so we can get them either excluded from the building if they are staff or isolated appropriately if they're residents. So that's actually, to me, the fact that we know about these cases is a real step forward so we can be proactive.
From you all's standpoint, can you talk a little bit about, because you've talked about this changing, the virus mutating. What have we learned? What is still relevant now as previous? One of the big things that was talked about very early on was being careful about surfaces, contact surfaces, wiping things down. We are still talking about hygiene. We are still talking about washing our hands. We're talking about wearing masks. Are we as worried about contact, about surfaces? And one of the reasons I ask is I've over the last couple of weeks while I've been gone, I've traveled a little bit. I've run into multiple traveling baseball, softball type teams that are out there. Kids, adults, in and out of hotels, things of that nature. As people are still doing some of that, still doing traveling, even the summertime is not completely over, even though we're back in school, people are still taking weekend excursions. What do you say to people who are making some of those trips? What do you suggest they need to do to keep safe? Because one of the things I will say about you all is you've also talked about you don't want to shut the economy down. You want people to be able to go, get out, enjoy themselves, take their family, but take precautions. Based on what you know right now, what are some of the precautions you would tell people as they take some of these weekend excursions to various places?
Eric, one of the things you talked about, and I think has changed in our thinking from the beginning, is carrying virus from your hands and rubbing your eyes and then having it get into your nose. And I think the thing we didn't talk about at the beginning was viral load. In other words, think about, I'm making these numbers up, but say you need to have 1,000 virus particles to become sick, to develop COVID. And maybe if you touched the surface and rubbed your eyes, you'd get 30 of them. Well, if you kept doing that over and over again, you would get to the point where you would have enough of a viral load that you would develop disease, which is why when we talk about a contact, it's someone being within 6 feet for 15 minutes. And it takes that 15 minutes of breathing the aerosols from the infected person to get that viral load that triggers an infection. And so I think one of the shifts in our emphasis has gone from hand hygiene, which we still encourage, and I think we all need to be careful about touching common surfaces. We need to keep our hands clean. But probably the realization that the vast majorities of these, I hate to name a percentage, but by far the vast majorities of people are sickened by breathing aerosols from an infected person. So I think there's been a big change in that. As far as traveling goes, I think as long as people wear masks, socially distance, when you travel, you're going to go inside a building to get food, take your mask with you. You're going to go into, I always pay at the pump, but maybe you go in to pay for your gas. And be careful of commonly touched surfaces, and I think you'll be fine.
Dr. Huth?
Well, yes. In the beginning, we didn't know for sure. Was it more contact spread? Was it how much was airborne? And it's pretty clear now that this is largely airborne or droplet from respiratory emissions. And I guess I would say I haven't noticed any reports, say, in the CDC's literature, the morbidity mortality weekly reports, or any reports back from Christine or the State Department of Health, that there are notable outbreaks related to people passing on from contact, like from a infected surface. I would think, for instance, that we would be able to maybe trace outbreaks back to gasoline pumps or other, I bring that up because that was an original fear of mine. I was concerned about some of the gasoline stations and so forth.
I still wear a single glove when I pump my gas.
And I don't want anybody to get the idea that they don't need to worry about those things. It's just that we, as Dr. Jetmore put it, we have a shift in emphasis to the airborne piece of this airborne droplet piece. That is the main thing. If you can't do anything else, wear a mask and maintain distance. But you should do other things. You should hand sanitize. You should be careful about what you come into contact with. I go to the grocery store as I did yesterday with my wife. We do that every Sunday after church. That's our normal routine. You walk in and there's somebody there and they've got all the carts lined up and there's a big sign says carts sanitized. What do? We grab a cart and we sanitize it ourselves anyway. That's just us. I'm not saying anybody else has to, but we are still being careful about those things because we don't know everything about this virus. And I would rather be safe than sorry in something as simple as wipe stuff down and sanitize my hands.
We talked a little bit earlier about some of the major colleges now saying they weren't going to have their fall, at this moment, football seasons. The IHSAA has not quite stepped away from football. Talk about in you all's minds, particularly since we have seen school-age kids come down with the virus. Talk about what you think Friday Night Lights should look like around here, because we're probably just a couple of weeks away from the pigskin flying, and people want to see it. They need it, particularly if the major colleges are going to step back from that.
Yeah, I've been in discussion with a couple of the athletic directors wanting to know, what does this mean? What are we supposed to do? And think about a football game. There's a lot of yelling, a lot of excitement, and that's 6 feet for 15 minutes.
As long as your team's not getting quashed,
Yeah. Oh, I yell louder when my team's getting quashed. I yell louder. But that like singing, it expels, it farther. So, it's important that when we're there, we're wearing masks. Fall sports are going to look different, if we have them. If we have them, they're going to look different. kind of some of the things that concern me more than people sitting in the stands cheering, because we're all facing one direction, and we can get that distance. And it was something that one of the athletic directors brought up is, what about the bathroom? I can't increase my bathrooms. And that may be what you see limits the amount of the crowds that come in there. Or how do we maintain social distancing and the necessities, like for a bathroom in the concession stand? And so those are being thought about. And, you know, that's not even talking about what's happening out on the field, you know, and I will leave those decisions to the people that the ISHAA, you know, to decide what they think is appropriate or not appropriate to do. I'm looking at the capacity, the fan capacity and everything off of the court or field.
Are you all making suggestions that, yes, there can be, but 50% capacity, 25% capacity? Are we talking specific numbers like they were with the Indy 500? Yeah. And I mean, the Indy 500 was at 50, then it was 25. Now we're running with no fans.
Yeah, and I've said to the athletic directors, you need to come to, just like any other large event, you need to tell me what you think you can do. I don't know your facilities. I don't know your capacity to have greeters and those staff people that you need to make this all happen. So you need to come to me with a plan that shows the health department, this is what we can do. So I don't think that it would be fair to say, you know, 50% capacity when there's an ability to do some different things, you know, and so we're very flexible with our plans, and they're going to come to me with the plans, and they're going to show me how they're going to overcome all of those hurdles that you need to. And the biggest thing is to maintain social distance, but then we also have to think about those unique things like restrooms, you know, and how do you, if you have 1,500 people there and 3 restroom stalls, how do we make this happen, you know, without everyone bunching up right there? And then all of our plans in the stands were for naught, you know. So those are the things that are being talked about right now. It's going to look very different this year, you know, if we have fall sports. I was kind of shocked to see the MAC make that decision, and so I don't know.
You know, all human endeavor that involves an audience is problematic in terms of people being protected from the virus, whether you're talking about a play, a symphony, a movie theater, a sporting event, because the very nature of these activities involves gathering people together in one spot to watch. And then there's also the problem that Christine talked about with bathroom facilities or people coming to get food, that these are all gathering points. But as she also said, the health department isn't there to design these things because we don't know what we're dealing with, but we're certainly willing to look at any plan that people bring us to help them to make it a safe undertaking.
As safe as we can make it.
Well, nothing in life is totally safe.
Right.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, also available on CTV3 in Connersville. We are not streaming to Facebook Live today because this is a pre-recorded version of the program. We are probably down to about 8 minutes. Want to make sure that Dr. Huth gets a chance to provide us with some updated numbers as he does every week here. So tell me something good, Doctor.
Well, the Wayne County numbers are probably for the week ended last Saturday moderated slightly compared to the week before. That doesn't mean there's necessarily a break in the trend, because there will be ups and downs, but we could hope. I think the numbers that Christine shared with me this morning was 63 for the week ended Saturday, and the week before that was 71. So, that's good insofar as it goes, but it doesn't tell us very much until we can get more weeks in a row of the numbers coming down. At Reed, the numbers actually have continued to moderate. We have a fewer total patients than all. We do have a patient on a ventilator this morning. We had gone a day or two without any, so we've got one back. So hopefully that will not grow. But the total numbers in isolation have been down a little bit compared to last week. And the total lab positives are also down a bit. So we're happy enough with that. We hope to see that trend continue to be down. Although I would say that it's been kind of flat, so we'd like to see it come down.
Are you all seeing, particularly on the health department side of things, a bit less resistance to the mask wearing, a little bit more compliance? Is that being helpful? Are you all seeing that here in Wayne County?
I think people are wearing masks more. I mean, from what I've observed, which is a very unscientific survey, because we all go different places. But I think that the success of the mask giveaway that the county had, the fact that people came to get those 300,000 masks meant that they were going to wear them. And that coupled with the governor's mandate that people have to wear a mask when they're in a public building, I see a dramatic change from a month ago. What about the experience of the others? They may have a different experience than me, or maybe similar. What did you see?
I feel like I see them more, which is good. They aren't always being worn correctly, and maybe a few more people could wear them. But I don't go very many places. I would say I mentioned earlier that we went to church this past weekend and then to the grocery store. And this is actually the first time I've been back in person in church since all this started, and I was actually very pleased with all kinds of things surrounding that. At my particular church, they had pews marked off, and there could only have so many people in there, and you had to sit in designated places. Everybody had to have a mask on. You had to sanitize your hands on the way in, and they asked us to not sing loudly, and they did not have hymnals in the pews. Instead, they were projecting the lyrics and so forth. I know a lot of churches do that anyway, but mine doesn't, but was doing it now because they didn't want to have the hymnals passing from one hand to the other. So I think they were doing everything right. And then at the grocery store, many more people than, say, a month ago were wearing masks and trying pretty hard. I could tell it wasn't perfect, but it was a lot better than it's been.
A lot of times it depends on where you're at. If I go down to buy horse feed or chicken feed, everybody's wearing masks. If I take a tire in to get it fixed at the tire store, no one there wears a mask. If I go to the grocery store, everybody seems to wear a mask. If I go down to Walmart, you see a lot fewer masks. So I guess it depends on the people and where you're at.
That's true. I had to have a tire repaired a couple weekends ago, and it just came up out of the blue Saturday morning, and I found a place that was open. I sort of had to get it done, and but no, they were nice, but nobody in there had a mask on. So I'm like, I'm going to sit over here way in this corner with my mask on. Let me know when you're done. And it was a little bit scary for me. I don't know if that's just me or whether they're not scared enough. I'm too scared. I'm not sure what. There's maybe some middle ground in there, but yeah, you're absolutely right. It kind of depends on where you go, but I can tell you the places I try to go, I try only go to places where they're doing a good job with it. I try to avoid places where they're not. I've mentioned before that I think that's maybe how we can have an impact on the retail establishments is if not only am I avoiding going there, but if I decide to leave, I'm telling them why I feel unsafe so that they start to get the message a little bit.
Christine told me that she's stopped going to cockfights because there's not enough mask wearing there.
Okay. We've got about 2 minutes left. Christine, I am going to turn to you and ask, I know the mask giveaway here in Richmond at the 3 sites was very successful. There was talk that the health department was going to try to figure out a way to do it in some other communities. Can you update us on any of those conversations? Does that seem to be coming any closer at all?
There hasn't been much movement on that, and that is more of a time issue than anything. The schools opening up has really just ate into all of my time, and then my right-hand man is on vacation, so he is the one that will be leading that up, and I know that he's gotten key people in each one of those community that he's trying to work with. Our staff is limited, so when we did our event, it wasn't just the health department doing it. Right. I can provide. I can't. If I could duplicate Dan Burke, I would make 100 of them, but I have one of him. So when we did our event in Richmond, Reed Health ran one of the sites, and the city ran another site, and then the county ran a site. So we are looking for our partners in that, and would hope that we can have this done before the end of August to have those. Wish we could have done them all, that one, Super Saturday, but that is where we are.
As we wrap up this week's Ask the Doctors, one thing I will say, having had a chance to do some traveling over the road the last couple of weeks, and you all have mentioned, and Christine, it was funny that you mentioned the restroom sites, because one of the things I really didn't think about when I started my travels, you sometimes used to being able to get off and run into a restaurant and grab a sandwich or something. They're still not dining in at all the places. So all the places you might think you might stop and run in for a restroom, those facilities aren't available. So you kind of have to think about that a little bit as you're drinking, as you drive down the road. Water, of course, or soft drinks. So one of the things to think about. One of the things that we've lost during the pandemic is just easy access to restrooms along the way. Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health, Christine Stinson, Wayne County Health Department. Once again, thank you all for providing your time and answering the questions. Thanks for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11 and WCTV Channel 21.